We'll call the meeting to order. Would you stand for the pledge, please? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And would you call the roll, please?
Yes, ma'am. Mr. Ward.
Yes.
Mr. Workman.
Yes.
Ms. Regola-Dye.
Yes.
Dr. Bennett.
Yes.
Mrs. Gadsden.
Yes. Here, thank you. Moving on to item number 1, approval of the minutes. And we have the regular meeting minutes of August 18th, board work session for September the 4th, and board work session September the 18th. I would entertain a motion.
So moved.
Thank you, Ms. Regola-Dye.
I'll second.
Thank you, Mr. Workman. And were there any additions or corrections? And thank you for the work sessions. They were very good, and I look forward to the next one. Judy, would you call the roll?
Ms. Regola-Dye.
Yes.
Mr. Workman.
Yes.
Mr. Ward.
Yes.
Dr. Bennett.
Yes.
Mrs. Gadsden.
Yes. Motion carried. No commendations or communications tonight, so we'll move on to item 3, reports and public participation. And Bill, I'll turn it over to you.
Well, thank you. Excited for you to learn a little bit more and to get a bit of an update from what's going on at Nationwide Children's Hospital. And so we have some guests joining us today. I'm going to let Lori, who's our resident Nationwide expert, introduce Mary Kay, and we'll get to hear a little bit about what's going on at Nationwide and then some ways that we can kind of help support that effort. So, great.
Hi, my name is Lori Shulman. I'm a nurse practitioner at the School-Based Health Center in the Mount Vernon High School. And I just like to introduce Mary Kay Irwin. She is our Senior Director of School Health, and she's going to present more about our clinic.
Thank you. Good afternoon. I'm happy to be here. We've been here now for a couple years, so I thought it was a good time to come officially to the board meeting and give you an update on the partnership and give you an opportunity to ask questions. I do, in companies like this, like to share that I started my career as a teacher. So I taught school for 6 years before transitioning into healthcare, and now I've been into healthcare for over 20. And I've spent those 20 years integrating school and health on behalf of pediatric patients. So it's a passion of mine, but I feel among peers every time I get to come to a school. So a little bit about, a little bit about the why. So why school health? So you're likely familiar with, there's quite a bit of research that really helps to illustrate how dynamically intertwined health and education are, such that children who are healthy do better in school. Those that do better in school go on to live healthier lives. And there's a lot of data even to suggest that when children have access to routine healthcare, they're more likely to graduate high school, they're more likely to be gainfully employed, have health insurance, and when people have health insurance, they actually go to the doctor and participate in preventive care. And so there is just a lot of reasons to do this work and to collaborate with school professionals. And what our aim and our why at Nationwide Children's is to find ways to create unique access points to care, in particular for children who don't have access to a routine medical home. So that is why we do the work. This is a bit of a peek around school health status for Ohioans. And so you can see the statistics here just further substantiate the rationale and are really tell a story of why you see such an emphasis of school health in the state of Ohio. So when I came to Nationwide Children's in 2015, there were not very many school health centers in our state. In fact, the preponderance of them were in Cincinnati, Ohio, but the rest of the state didn't have much to speak of. And thanks to Governor DeWine and his passion, for really families in general, overall well-being, and seeing this as an opportunity, he has availed our state of a ton of resources. And so now we're at a situation in which the Department of Education and Workforce, Department of Health, the Department of Medicaid, the Governor's Office of Appalachia sees this as a solution for children and families in our state. And so we are in a totally different situation, have seen dramatic growth of school health, and now we have representation of school health clinics all over our state, and we anticipate more to come. So this is a little bit of when you sort of break it into health and academic benefits of why do school health. So we know, I already alluded to from a health perspective, we know that children who have access to timely health care, timely medications, and let me say also high quality comprehensive care, they have improved physical outcomes, mental health outcomes, reduced hospitalization, and live the lives that we hope to all live. From an academic perspective, we expect lower rates of absenteeism. So we want to be seeing that we're helping to improve chronic absenteeism wherever we provide services. When we do primary care mental health, which is taking care of the mental health needs of students, we would anticipate that we would be helping to reduce disciplinary rates, right? So any good health partner is holding themselves accountable, not just to improving health outcomes, but in a true partnership way with the district to try and improve your academic outcomes in collaboration. This is a peek at the school-based health centers that we run. We did a study around what's called saved seat time. And everyone knows inherently that if you bring healthcare services to school, you must be improving attendance. But there's not a lot in the literature about this. It's sort of like an assumed, everybody just believes it to be true without a ton of evidence. And so we have done a couple of different things with our school-based health centers. First is a match study where we looked at similar schools that did not have school-based health centers compared to the similar schools that did. And we found that those that had a school-based health center overall had a 3% improved attendance rate. And then also when we looked at children in a particular school that had access to a school-based health center, so those that did go and use the center versus those that did not, and we actually saw the same percentage, a 3% increase. And then the other side of that line is something called saved seat time. So the National School-Based Health Alliance really holds this model up as a way to measure improved attendance when you have school health going on. So essentially what happens oftentimes when a child leaves school to go to the doctor is that mom sometimes takes out multiple kids because she's not going to be home to receive the others off the bus. Or it could be that the doctor is far away, or after the appointment, oh, you missed lunch, let's hit up McDonald's. Now there's only an hour left. Is it worth going back, right? And we even sometimes have providers saying, oh, you want me to write you off the rest of the day? Well, I think the challenge is in our state when we have such a chronic absenteeism rate, we really need to be thinking about how we improve seat time, right? The academic time in the classroom. So we did a study across our school-based health centers, and what saved seat time is the definition of it is the amount of time saved at the end of the appointment to the end of the school day. So in other words, a child going to a school-based health center is going to have how many saved seat minutes compared to somebody who went to an outside appointment, right? And so what we found overall is that for every single appointment that a child has in our school-based health centers is we are saving a little bit over 3 hours of saved seat time per appointment. So just some ways to look at this in terms of how we can help improve attendance. So we're a huge operation, but the 4 faces on here are probably the most relevant to the Mount Vernon partnership. Me, less so up there in that corner. The other women on here are much more important. So Lori, the nurse practitioner, obviously. Jennifer and Bridget. And so Lori and Jennifer are here staffing the clinic, and Bridget is in a role called School Health Liaison, and her job is to help with engagement, marketing, communications, pulling data if you want to review that with regularity, which we do, with the school staff. And then this is a quick peek at the services that we offer. So anywhere we provide a school-based health center, we are committed to comprehensive primary care. So we are going to do everything from soup to nuts because we want to be comprehensive, right? And so that is well visits and vaccinations. That is acute sick visits, and at this point we have a lot of capacity, so we can do same day without a problem. Also sports physicals, work permits, and chronic disease management. So helping children to really manage their own diabetes, manage their own asthma, work on nutrition, obesity. All those things are available in the clinic, and then also what we call primary care mental health. So primary care providers are capable of helping with a mental health load when they are trained. And so we work hard with our nurse practitioners to help them feel comfortable using that aspect of their license. So we kind of talk about working to the top of the license. The license allows it, but a lot don't do it. So we lean on our large psychiatry department to help with training so that the nurse practitioners are well-versed in the diagnosis and the medication management of anxiety, depression, ADHD, and as that becomes comfortable, then even moving on to other things like oppositional defiant disorder, et cetera. To be clear, this is not a replacement for therapy, right? That what we're trying to do in this service is to fill a gap. And we know that not only here in Mount Vernon, but across the state and the nation, we have a workforce shortage of mental health professionals. It's a problem everywhere. So there are a lot of people working on the long-term solution for that. So that's like pipeline development, where we're encouraging young people to go into these professions, therapy, psychology, psychiatry, and that work is critical, but it doesn't fix today's problem, right? And so the biggest gap seems to be the ability to have somebody who's trained in the diagnosis and med management for those who need meds, because not everyone does, of course. This is not duplicative of school-based therapy, it's a complement. So we can do this in our clinic where we can fill that gap, and we can do the straightforward, I'm gonna say, ADHD, anxiety, and depression, thereby pulling those kids off of the wait list of the psychiatrist, because the psychiatrist, really, we wanna preserve that for the children who are a little bit more challenged by their issues. And then when the nurse practitioner in the school health clinic says, okay, I thought this was gonna be straightforward and the child is not responding like I thought, we need the expert, then we offer telepsychiatry so that the child can be seen via telepsychiatry right there in that school clinic with mom, dad, if they wanna speakerphone in, if they wanna, FaceTime in, or even come into the appointment in collaboration with the staff. This has worked very well for us, and we have effectively reduced the NCH psychiatry wait time effectively by doing this, and more importantly, Mount Vernon students can be seen by both Lori and or the psychiatrist if needed with next to no wait, which would not be the case at main campus. So just a bit about our numbers here. In the last school year, you can see we had a total of 471 visits. That was an average of 3 visits per day. What I will share with you is we have a lot of unused capacity. And so we would like to see more kids. We would be really trying to hopefully be seeing 12 to 14 a day would be the goal. It's important to know that we are not trying to replace relationships that people have with their family physicians. So those relationships should remain intact. If someone is in a relationship with a pediatrician in town, but say they can't get in, they're welcome to use us for a quick convenience appointment. What we do then is send what we call an after visit summary back to that child's pediatrician so they know, hey, we got them in real quick for a strep test and here's the results, and we encourage that family to do the follow-up with their pediatrician and to maintain that relationship. When we decided to come to Mount Vernon, this was not just because, right? So we used data and we looked at the pediatric health outcomes and utilization in your region, and we could tell that there were a preponderance of children who don't have those relationships. So we really came here for them. We really came to create this unique access point for kids who were either just going to an urgent care or maybe to like a clinic that is, in a grocery store, for example, and those situations don't provide that high quality comprehensive care, right? That preventive wellness, the chronic disease management. And so that's why we came. So that remains our mission. We are open to anyone and everyone. So for folks who have a physician in need and want to use us for something quick, they're welcome to do so. But we certainly want to be the medical home and connecting for those kids who don't have one, so we can take comprehensive care of those children and families. And then Mount Vernon city students are always going to be our first priority, but we're also open to children and adolescents from the community, and we can see children 0, so we can see babies all the way up to age 22. So even for those in career tech and college. And often in some of our other school-based health centers that have been open for a while, we find that the 18, 19-year-old wants to come back because they've formed a relationship with their provider. So that is the goal, and that's how we're doing today. We've spent some time at our kickoff meeting kind of talking about some of the barriers and maybe some of the solutions with superintendent, with the building principals, with school nurses. I do think there's probably some more opportunity from a marketing standpoint so people know exactly what we have to offer, what we're here to do, and why. and to address any uncertainty if people are scratching their head, like what's really going on, which is one of my purposes here today. And then also to talk about the transportation opportunity, which is bringing the children from the nearby schools to where the clinic is. So the team has been wonderful working with Lori and with the team around strategies to kind of address these three things, as I mentioned, so we can take better care of the kids who need us in this community. So in review, we are really trying to focus on students and families that are overdue and are not connected. And then we want to be your whole child partner. We want to be a gap filler. We want to work in collaboration with your special education staff, with your nursing staff, your guidance staff, to address the concerns that you have for the children and adolescents that you guys are responsible for. So this is a picture of our two esteemed colleagues, and I think they were in theme on this particular day, matching what you guys were doing in theme. But this is just a quick peek at some of the things that we've done just as of late. So I always say, to me, we have really reached success when the community isn't really sure. I mean, sure, Nationwide Children's, we're always going to hold ourselves to that standard of care. But the moment these women are mistaken for Mount Vernon employees and they just think that they're a part of this district, that means we won, right? Because we're trying to be ingratiated in this community. So to the extent that folks have other ideas of how we meet more families and offer our services, we are open to your suggestions now, in the future. Because this does oftentimes, when you're trying to reach those who are disconnected, it takes some effort, right? To make sure that they know that they can trust us and see us as the resource we want to be. So that's all I had to share. I don't know if you guys have any questions or.
We just have, go ahead.
I was just gonna ask what age you said they begin?
0. So we do baby.
22.
That's right.
I put 4 to 22. That was a guess.
Was there anything else you had, Margie?
No, go ahead.
Okay.
Thank you.
I don't know if you have any ability to attend and set up a booth at any of our local First Fridays and our Dan Music and Arts Festival. And of course you were at open houses. And I was wondering if that opportunity has been available to you, if you've been able to do that.
Yes, we have been at the first Friday for the past 3 years, and we do get a lot of interaction with the families. And myself and Jen, we're both residents of Mount Vernon, so we get a good opportunity, like at many other functions that we might just be out and about that we do. But yeah, the first Friday is really good. We did not do the Mount Vernon, I think I was on vacation for that one, the festival, yeah. But yeah, certainly something we thought about.
Great. Good.
Which was that festival again?
Music and Arts Festival
Okay.
in August.
Okay.
It's a 4-day event.
Oh, okay, yeah.
And they pretty much shut downtown down.
Right before school starts.
Right, that would be,
Basically.
those are the opportunities we're looking for sure. That'd be great.
Thank you.
Have you, and I don't know because your age is 0 to 22, any communication or connection with MVNU since you're, literally right there?
Yes, I work with Jolie, the nurse there, and so we're trying to see if there's other, flyers that might better suit the college students as opposed to the high school or the elementary students. So I'm working with her now, because the students don't often think of us.
Correct.
We want to get to their parents, because we feel like if their parents, if they called home and said, hey, I'm sick, they
Right.
might say, why don't you go to the clinic over there? So
Yeah.
I'm working with her right now on that, but thank you.
Super.
Okay.
How is the transportation set up? So you have kids that are at the elementary schools. How is that set up now?
So we did a little bit of a pilot at the end of the year last year, and we use a school bus. And we tried to carve out a couple chunks of time in the AM and the PM. We designate a particular school that we'll be working with on a given day. So let's just say it's Dan Emmett Tuesdays. And so we leave these blocks of time for parents to sign up for the services that you saw. If they don't get anybody to sign up, then we just don't have the bus go at that point in time. But the students are brought over on a bus with another adult and the driver. They're there in the clinic with the students. The challenge sometimes is you can only bring what we say, but we're working on 2 per visit, because you don't want them just sitting in the You know, we usually bring them back and put them in a waiting room, but we want to try to get them in, get them seen, and get them back. If you brought over more, then it makes it a bit more of a challenge. You start to lose that seat time. We kind of did it during testing time last year, which wasn't the best time to do it. And so I don't know how many we really got to see at that point, but we piloted with Dan Emmett and Pleasant Street because we kind of felt like those were some of our buildings that had the greatest need, or quite frankly, no primary care physician. But again, it's getting that word out that's really, really important. So I think our goal is to develop a schedule and to try to hit all 6 elementaries at some point during a 2-week period of time.
It's another good reason to look into possibly having new buildings in the future where children would be able to attend our facility at the high school and not have to worry so much about.
There's a lot of planning to do that, I mean,
Sure.
right now.
Yeah, we've been working on that together. They have models that they do at other schools where this does take place. Oftentimes those can kind of be at central campus type feels, or you only got one building you're working with. Throw 6 of them in the mix and it becomes a bit more interesting.
I will share that this in Columbus City Schools, of which I know is totally different dynamic, but we actually transport from 70 different schools. So we have done this in big environments, small environments, and it's really worth it because what we're trying to do is reduce barriers, right? So if we know that school buses can pick children up and bring them to school, and that really helps parents who have struggles with, whether it's a single parent and it has to go to work and all that kind of stuff, or whether they don't have transportation. And so when you can do this, it really mitigates barriers for families by bringing them over. So you just eliminate the transportation challenge. I should say too, is that, our goal here too is to make relationships with your parents too. So all the care is consented care, right? And when often what we find is once a mom or a dad or a guardian finds out what we have to offer, they're like, oh my gosh, I've been needing this and this is great. So I just want to make that clear too. So parents can also, like if they're going to pick their child up for a sick visit and they want to swing by the clinic, that is also an option. Before they go home, we can do it that way. But this transportation piece is important, and we appreciate your willingness to pilot last year so that we can make sure we're taking care of those kids who, otherwise may not be able to get to us from our transportation.
And just to be clear with the pilot, that was more in line with preventative health care. It wasn't like, I'm sick this morning. And we just, we send the bus to a particular school to pick up kids. It was usually predetermined, we're gonna be there on a certain day. And if you need vaccinations, preventative health, or any one of the services that you can almost schedule, that was the idea. Acute care, where they're sick that day, that's a bit more challenging. And we would, quite frankly, encourage the parents to bring them.
Yeah.
What about, I know like in November, we have parent conferences coming up at all of our buildings. The kids are not in session those days, but getting out and meeting with parents as they come in for their conferences and that kind of stuff, is that a missed maybe opportunity that you could have a little more conversation with parents?
I think we've tried that, but we've been there. And I would say just the other thing, so we have 20 total school-based health centers in various areas, and then we also serve the Department of Health and also with the governor's team as the state's consultation team. So we're all over the whole entire state helping other providers do this work too. And what I've learned about parent conferences is there are a few places that works great. There's a lot of places it doesn't. And I think until we try it a couple times, it's hard to know, just because sometimes districts don't get a big turnout, depending on where you are, so then that's not great. Other times people sort of come in like with a mission, and stopping by. But we have other places where they get great parent turnout and it's like an epiphany, and so it's just one of those trial and error kind of things. And so I know you've done it before, but we absolutely want to do it again.
Okay, only because this is my world, preschool world.
Yeah.
Have you reached out to like the ESC, Head Start, and those entities? Because I know a lot of those would be interested in the preventative care, just to see what opportunities were like. And then you build those, as you said, building those parent relationships you're starting young
That's right.
and building those relationships, so that
Bridget,
too
I don't-
may
do you
be.
I've reached out to the daycare at the Career Center and the one at the NAS. I've
Yes.
been to both of them.
Yes.
But I know there's more in town,
Yeah.
it's just
Right, through the ESC, they have programs, and then the Head Start.
ESC.
The ESC,
Knox
okay.
County Educational Service
Service
Center.
Center, yeah.
Mhm.
Yeah, we've worked with them in Franklin County, but I don't think we've ever been in contact with the ESC in this area.
Yeah.
Yeah, that'd be great.
Yeah.
Maybe we could reach out to you. Do you have a contact?
I sure do.
Okay.
That'd be
Lots of contacts.
What was that? Middle school had a wonderful open house kind of thing where the kids showcased. What was that called?
We go to that.
Were you there?
We do that, yes.
Okay,
We're gonna have the tables and all out, yeah. That's good exposure.
I remember you being.
Yeah.
I was gonna ask about the Career Center. Do you have many students from the Career Center who come over?
We are actually, I just met with them, with their, student services group, and I met with all of them, so we are starting to get more. We did initially, and then it kind of tapered off. I think people forget that we're there, so we're doing this whole come up again. So yes, we have actually been getting more of their students. And their nurses, I have a
It's very
good
convenient.
Yeah, I mean, obviously can walk to us essentially. But we have a good, we make sure that they know they're coming when we send them back, so everybody's expecting people coming and going.
Thank you.
So just as an informational piece, we meet monthly with our other colleagues from nationwide, and we talk about these kinds of issues, pilots, and things we could do better. I know sometimes when you see a word like marketing, it makes it feel very business-like, and it is, quite frankly, but they have really honored their commitment to not, well, they're not seeking to take over primary care physicians' clientele. And I know sometimes that seems to be a worry. When they first came here, we said that a little over 60% of our students, when we looked at our emergency medical forms, had no primary care provider. And that's the gap we're trying to fill in. So when you think about marketing, it's like, how can we make sure they understand who we are, where we're at, how we serve them? Because the reality, you may look at that big number and say, 471 visits, but 3 visits per day. I mean, you're open from what time to what time?
8 to 4:30.
8 to 4:30. Can you imagine being in an office from 8 to 4:30 and getting 3 visits a day? So there's capacity that can kind of grow with this. And as much as we try to get it out and just share the opportunity, we're seeking for more ways to do a better job of that.
Do you think that because there were some conspiracy theories out there some years ago, that has had an effect upon how many parents take advantage of our school-based?
I mean, hard to tell, possibly. What I will share with you is in the work that we do around the state, those kind of conspiracy theories are pretty common. So we do try like Mythbusters, what's real, what's not, right, with school health. And so, if there's more work to be done, I mean, I welcome the opportunity to meet with the people who maybe think it's something that it's not. I'd rather have the conversation. At this point, I think I've heard it all. So do I think that could have, maybe, but I think our stay power and our commitment to really trying to market, if you will, to those that we know are here and need us. I think we've demonstrated over and over again that we're not disrupting, relationships with existing providers, and that's our commitment at all 20. So we only do this to create unique access points for care. And so I think hopefully State Power showing up, and hopefully when people come and have a good experience, is they're sharing that experience and we kind of get around it. Nothing's bubbled up to me as of late in terms of some of those early concerns. I've not heard that at all. I don't know if anybody else has.
The biggest concern I think we got, which I think you've done a wonderful job of saying it's just not true, is that we were gonna see kids secretly and not talk to parents.
Right.
I mean, they go out of their way to make sure not only do they get permission prior to the visit, but after the visit, they're contacting parents and letting them know exactly what happened. And that was kind of that conspiracy thought that was gonna happen. and it's not happened. And they do a great job of communicating, like I think most doctors do, but they really held firm to that commitment. And they understood that that was the only way we would let them be here.
Right.
And of course, with the Parents' Bill of Rights and all of this other stuff that's out there, we're doing it already. We don't have to change anything because we've always wanted our parents and families to be informed.
Will there be space in our newsletter to just put a little blurb about this?
We've done that, we can continue to do that. I think it really is, okay, what is that gonna look like? Because I think for the most part, we've had, and they developed that, at Nationwide. We almost need to tell success stories or something that's, I needed to get someone in right away and this was my experience. You can put a little bit of a blotter that basically says, we're open from, 8 to 4 and here's what we do and call this number. I don't know that probably rings the bell quite like someone sharing their experience or a video or, being able to kind of articulate exactly the experience they had when they went there.
Do you have any kind of follow-up, like exit interviews or anything, or somebody that you've seen, you might call back and ask the parent what their experience was, or we could get some of those kinds of stories and testimonials, or?
Usually what happens, and you can tell me if you feel differently, but usually what happens is once a connection is made, they just, this is an answer to, all the things, and we develop relationships really quickly. We have actually talked about in our last meeting, making a video and featuring some people, from here who have done that experience so that we can actually use it and kind of send it out for people to see. So I think that's in a planning phase, but that is definitely something we intend to do here soon.
We also have a weekly newspaper that I think we just got today. I wonder if they've ever interviewed you, or that would be something that would.
Ops Weekly, yeah.
Oh, that would be good.
I was interviewed when we first opened.
On pages?
Yes.
This is a weekly newspaper that's
Well,
available
yeah,
to
cousin.
residents.
Yeah, I've not been part of them. I know Corey Kaufman has asked like maybe the Jacket Journal to come and maybe do something with us. I just think it was kind of the end of the year and now they're busy with everything now. So I think that's definitely something they're trying to figure out.
But I like your suggestion too, that would be great, a weekly. Because
And I don't know how they get on their schedule, but, like they report on our athletes and all kinds of things and special interest things in the community. That might be
Yeah, that's a
something.
great idea.
Because it's a resource for our community.
That's a great suggestion, thank you.
Any other questions?
Thank you.
Mary, thanks for coming in, I certainly
I don't have
appreciate
phone
it.
numbers,
Thank you.
so I apologize for that, except for mine.
Okay.
But, and then there's Fred Main is at the Ops
Okay.
Weekly, so you need to contact there.
Okay, thank you so
Thank
much. I
you.
appreciate it.
Thank you.
Thank you.
Thanks for coming.
Appreciate what you're doing.
Thank you.
All right, moving along, no board items for discussion this evening, so we'll move on to item 5, additions and deletions. We have one.
We do have one addition to section 11B1D, a sub-teacher, Marilyn Nagy, so put Marilyn in there. She definitely is passionate about her books.
Oh, yes. And moving on to superintendent's report.
All right, I do have some things to share. I don't know why, I feel like I got a hoarse voice all of a sudden. Sound hoarse, a little hoarse, yeah, and I feel fine, so I get the medical people back in. So I really wanted to take some time during this board meeting to share a little bit about our district report card. You've seen some little bits and pieces here and there, but I thought maybe this would be a good time to dig in just a little bit more, knowing that our agenda is not quite as long this particular month. So our school report card, this is the traditional makeup of what makes up a report card. And I've linked all this in your thing if you want to go back and take a look. So the achievement part, that's 25% of your rating goes for all the tests. Those are things that take place at the end of the school year. The graduation component is 12.5%, and so that's 2 cohorts. That's not only the 4-year cohort, but that's the 5-year cohort, in other words, 1 year after. Early literacy is another component, and that's the number of students who kind of move from kindergarten to 3rd grade and are proficient in reading. And yet we kind of put them on things called RIMPs. You probably have heard of those. And we're still always kind of navigating what's the right way. Put more on RIMP, less on RIMPs. What does that mean in the long run? But that's 12.5%. The progress component is kind of that value added component, how much they've grown from 1 year to the next. This brand new measure, it's 12.5%. It's called College Workforce and Military Readiness. We affectionately name it CCWMR. But it's a brand new measure, and I'll talk a little bit about that. And then gap closing is how we're closing the gap between our subgroups. So it's how much are we taking our special ed kids and moving up? How about that social economic group? How much are we moving them up? And it can even be down to ethnicities and so on and so forth. But how are we closing that gap to get them closer together? And so you take all of this together and you get a rating. In Ohio, you get a star rating. 1 means you're significantly falling short of state standards, and you need significant support. If you get a 2, you fell short. If you get a 3, it means you're meeting the state standards. If you get a 4, you're exceeding the state standards, and if you get a 5, you're significantly exceeding the state standards. In Mount Vernon City Schools this year as a district, and so they'll rate you as a district, and then they'll break it down and even go individual buildings. But as a district, we were a 4-star district. And so we feel really, really good about that particular rating. As a district in achievement, in other words, those tests, we were exceeding the state standards. I'll share a little bit more about that. Progress, we are a 4-star district. Gap closing, we're a 5-star district across the board, and you'll see that in the building ratings as well. Graduation has been one that has been a bit of a challenge for us in the past. We've met the state standards, but we've always been in that 90, 91%. Through a lot of effort, we're up to 94.7% in our 5-year cohort average, and they've really been doing some good work there. Early literacy is a measure we're still trying to navigate. Even though we have half of our elementaries are 5-star buildings, we still are at this 3 in early literacy, and that is pretty common among the state. I don't know that we've seen any early literacy that's been a 5. Few sneakers have gotten up in there in the 4, but again, it's trying to find out how all that's calculated, because trust me, our elementary buildings who are 5-star, they're looking at that 1 mark that says 3, and they're like, how do you get that? And so we're really working on that. And this college and workforce and military readiness, this is one I've shared a little bit with you. We got a 2-star here. And it's a brand new measure this year. It's the first time it's come out in the grade card. Ironically, what it's measuring is a senior class from 2 years ago. So 2 years ago, not last year's graduating class, but the class before, how were they relative to college, career, workforce, and military readiness? And I'll share with you some information about that, where we're at from that year to where we already know what next year's score is going to be, because it's always a year in the rears. And we took some big steps knowing where we would be a year ago. So as a district, we're rated as a 4, and that is as high as anybody regionally that we're within. And I always love this one. In our 20 district cohort, I know this is very small. You get a chance to take a look at this later. There's only 1 district in our 20 similar cohort district that's rated higher than Mount Vernon. And you can see the names: Ashland, Eden, Midview, Bellevue, Louisville, Salina, a lot of school districts here. But you go across the board as an overall, and you'll see they've taken that and they've really kind of encapsulated what that would look like. So to rank in the top 10% or of that whole group, I'm really proud of that. And yet we're not satisfied, which is, I'm even more proud of that, because we're always looking to kind of improve. So I'm going to give you a little bit of a note here. John Fry did all of the graphics. Thank you, John. And so we really wanted to to share with you an accurate depiction of each building, but I'm always wanting to highlight the things that are really good, right? So Columbia was a 4-star overall rating, and that's really good for an elementary. Their achievement was a 4, their progress rating a 3, their gap closing was a 5, and they got 3 stars. So as a building, they were a 4. Dan Emmett, we had fun making a half, but overall, they were a 4.5-star building. And so when you look at the socioeconomics and all of the things that kind of make up some of our buildings, they've really done a marvelous job at Dan Emmett creating that kind of environment. 4-star achievement, 5-star in value adding, in other words, year over year, 4-star in gap closing, 3-star in early literacy, which all of our elementary's got that score. But to be a 4.5-star is really strong for them. East Elementary, they're a 5-star overall district rating. And you know that for them, they've been blessed. You see them in their blue here, whether that's a picture from this year or their blue ribbon year, to get a 5 overall, 5 achievement, 5 progress, 5 gap closing, and an early literacy score of a 3 it says an awful lot. Pleasant Street Elementary, they were a 5-star gap closing school, but yet they were an overall 3.5-star rated school. So we know we got some work there. Testing, they were a 3 in progress, a 5 in gap closing, and they did have an early literacy rating of 2. So while they met all state indicators, and we're even above in their overall rating, really good job in gap closing. This early literacy score is something we're certainly going to focus in on. Twin Oak Elementary was another one of our overall 5-star ratings. 5-star in achievement, 4-star in progress, 5-star in gap closing, 3 stars in early literacy. But again, this overall score is really impressive, realizing that we have 3 buildings, including Wiggin Street here, who have an overall 5-star rating. You'll see this is very similar to what you saw at East. 5, 5, 5, 5, and 3. Probably one that I'm just incredibly proud of is Mount Vernon Middle School. So they will recognize that they've been that challenge, because when you bring 6 elementary schools together, we've struggled for years to try to get kind of off of kind of that just average range. In every single category, all 4 of these, they improved by 1 full star. And that's a result of great work by their administration and their staff. But to overall be 4 stars, testing achievement 4 stars, progress rating 3 stars. So what I'm saying here is every one of these would have been 1 star less last year. And so they're making some significant improvement. The high school continues to do a really good job. You're seeing all 4 stars, 5-star in gap closing. We got this one little sticky one down here that I'll share just a little bit more with you, that they didn't just start working on this when it came out. We started working on this last year. And so you'll see where the results of that probably come in. Here's a composite of all of it. Again, you can take a look. So, Columbia across the board, you can see where they were, Dan Emmett, so on and so forth. You see a lot of 5 stars in here. That means we've significantly exceeded the state average. Did want to bring some snapshots into picture. And so as you look at 3rd grade here, and I'll do one for each grade real quick. We are the blue, the dark blue. The green is our similar districts, those districts that are so similar to us, and then 5 is the state average. My goal every year, our goal every year, is to be higher than our similar districts and to be definitely higher than the state average. It's really, really important. So when you look at 3rd grade, down here in math, we're at 74.9%, similar district 69, and the state was 64. I'm not going to read through every one of these as we go down through, but I would love for you to be able to keep this in mind. Look at the district score, and then just quickly look here. You're going to find in many instances we can get close to 20% better than the state average. 20% is pretty good, right? So that's 3rd grade. 4th grade, you're seeing a similar kind of a pyramid effect, all right? And so, you look at mathematics. As a district, we were 88% proficient. The state average is 69. I mean, that's close to a 20% difference, and that's really, really impressive. You look at 5th grade, we tested 3 areas. Again, when you've got this kind of a movement, you really, really like seeing that. Again, 83.9% in English, state's down to 67, even bigger here in science, 83, down to 63 as a state average. So we're really pleased with those scores. Jumping into the middle school, again, you're getting your same kind of averages there. I mean, right here you look, it's almost a 20% difference in mathematics than the state average. This is over 20% in English. So we're real pleased with that. Little bit of a level here. We're still above the state average in 7th grade English, but just slightly below our similar cohort. And I can tell you they've already started sneaking in and taking a look, comparing last year to see where they can make some difference. Then in 8th grade, they do test in 3 areas in 8th grade: science, math, and English. And you can see, I mean, you're starting to see some real big differences. Look at math in 8th grade. You know, it must have been a really tough test, but for the state average in our similar districts to be right around 50%, here we are at 70, almost 76%. Again, scores we're really, really pleased with.
Well, that makes you know that the 7th grade was an anomaly too, because
Yeah.
6th and 8th were.
They were good. And so you probably could go back, if we went back and looked at last year, you probably could have seen that as 6th graders, they might have been closer to the, to their similar districts and maybe the state. So sometimes you just get classes that come through, that will kind of line up that way. At the high school level, we have 6 measures, testing-wise. And so again, Algebra 1, you see us with that nice dip that we like to see, 76% for our district, and you're down to 59 at the state. Same with biology and same with American U.S. history. So all trending in the right direction, that we're exceeding state standards, and certainly that group. Here's the one that's a little bit interesting, and I shared a little bit in our board update. But again, English language arts is 2. That would be more of your 10th grade English. Geometry is generally a 10th grade class. However, government ends up becoming a junior or senior level class. And so when you see this isn't the direction we want to be. And that was certainly something that Kathy and I have spent some time really drilling down, working with Ben and Corey at the high school. And there's some interesting reflection that we can glean from that. I shared a little bit with you in our update, and I think I have it in the next slide there where I can share it a little bit more. So we do have some focus areas for improvement, because like coaches, we can celebrate our successes, and we're celebrating, but every coach finds a reason to stay engaged and keep fighting to get better, because we never feel like we've reached that perfect spot. We're going to be meeting with principals here this week, elementary principals, and we're also going to have some conversations at our DLT about early literacy and how we can maybe make this thing get into the 4 range, because we do so well at the elementary and everything. Why is it not reflective here? And I think there are some things that we might be gleaning forward. When I shared with you that government score, and again, this is just a quick snapshot that I shared with you in the board update, 2 things we're really going to focus in: targeted support for our digital academy and the Knox County Career Center. So when you see the word 86%, those students who stayed at Mount Vernon High School and took this test, 86% passed, and that's really, really high. But as a district, we were 71%. The challenge sometimes comes once they leave us, and they go to, in this case, they go to our digital academy or the Knox County Career Center, our numbers drop a little bit. So we want to work with our partner schools. I will say, even at our digital academy, which we own, right? 0 out of 14. 14 kids took that test, 0 passed. Tells us that we've got to do more work at our digital academy, making sure they're prepared to take this particular test. At the Career Center, 59% of our students who went there passed. And again, they're into other things, you know, they're into their labs and all of those things. You know, if we can provide better support, then we need to work together to make sure that happens. So that's not, I'm not casting a disparity on any individual group here. It just gives you a better picture of why 71 was our overall score, and yet we're doing some other good things. The other thing that is really disappointing here, and this may be even a bigger piece of the puzzle, is that we need to incentivize our CCP and AP students to take the exam. So think of this, you're a junior or senior and you get to take this government end of year test. Well, if you're a CCP student and you take a government class and pass with a B or better, you don't have to take the test. How many of you think are going, well, can I please take it?
So there's all your top students.
Our AP students right here. We had 18 students take AP government. Those would be our best students. Do you know how many of the 18 took the government test? 6. And so, and they don't have to take it. You know, we want them to take it because we want them to help boost the team score, right? And do all that. But it's part of law that if they get a certain score, they don't have to take the test. And nobody wants to just take extra tests to take them. But if you take 2/3 of my top government kids and say you don't have to take the test, well,
It's going to skew the score.
That's
it lowers your score. So there's a story behind that government score. Still doesn't mean we're happy with it, but how can we incentivize our CCP and AP students to, you know, to engage with us and get involved? We might have to incentivize it, right?
And how many are at the Digital Academy that would have not,
Did you say
you know what that
14?
number is?
We had 14 who took it
Okay,
and
sorry.
none of them passed.
How many are at the?
My calculations that we had 16 take it and I had 4 that passed. Now granted, it's 25%. Those were my calculations.
Oh, maybe I mistook.
It's still not good.
Right, no.
I want to celebrate the couple that did.
Yes,
And of those, I mean, I didn't dig deeper into it, were they retesters?
okay,
So it's possible that they
Gotcha.
passed it at the DA, but that was their second time attempt at it too.
okay.
But no, it's still not good and we have lots of room to grow. But it is one of those, the state does allow, you know, your kids that are getting college credit, whether it's an AP course,
Right.
or CCP, they're taking something equivalent, they're exempt from it. They don't have to take it. And it tells us, you know, with that course, what they're able to get, you know, the check mark that for their seal or any of those other
Right.
things. So it is a sticky wicket that it puts us in, knowing that there's another layer to this report card.
Right.
So whether it's 14 or 16 at the Digital Academy, how many kids are at the Career Center?
It's probably about
99%, just ballpark.
that took the test.
Yeah,
I'd say about 97, 100 of
Oh.
them that took it.
it's a big one.
Right, yeah.
It's a larger chunk.
Yeah, just curious.
Again, there are reasons why folks go to the Digital Academy, there are reasons why folks go to the Career Center. They may be more employment focused and, you know, just getting their credits. And so we have to realize that and try to amp that up as best.
Okay, thank you.
Question, what grade level is that government test offered at?
It used to be a senior one, but now they take it down to junior year, generally speaking.
Okay,
And so that's usually for us, our junior and senior years, that's when students generally will go to the Career Center. That's when students will generally start CCP because they want to get those college credits. Generally, our 9th and 10th graders, for the most part, stay in-house. The college, the CCWR, which is College, Career, Workforce, and Military Readiness, it's intended to measure how well a school district prepares its graduate cohorts for post-secondary paths in college, workforce, military service. It's based on students in their 4-year graduating cohort in the graduating class, and it is lagged by 1 year. So the data is based upon the prior class. So we just had graduation last May. That senior cohort, last May's seniors, that will be reported on next year's grade card. So we have to go back then and look at the graduating class from before. And because of these pathways, we didn't have, we just started really thinking about that. As a matter of fact, we hired Chris Keaton last year to be a career readiness advisor. Kathy was working with our folks at the high school on new pathways to try to develop some new pathways along the way. Well, we developed those last year. So we now have a senior group who's only had 1 year, by the way, of the different things that we've created. And yet we're gonna see what we believe to be a significant difference because of just 1 year's worth of implementation. Chris is working with freshmen, sophomores, juniors, and seniors. We're developing pathways now that we can have folks as early as their sophomore year, for sure their junior and senior year jump into, which is going to continue to count towards that piece.
I wonder how they get the data, because people don't respond to surveys anymore. So if they contact them during that year to see if they're in college or working or whatever, do they get a good?
These are things that they had to do, these are things that they had to do while they were in our enrollment.
So a lot of them won't know then, right?
Well, no, so if they went to COTC or they did a class at the NAS, we have that college credit, so they did it while they were still a Mount Vernon student.
No, but I'm saying so you're not talking about when they graduate?
Correct.
Whether they've done, whether they've gone.
This is
into the
as
military.
they were a student with Mount Vernon High School. You
What
know,
they've done.
before they left us, did they sign up for the military and did we get their DD form? So it's a lot of things we're peeling back the onion as far as our student information system has a couple different spots where you can put military enlistment.
Okay.
One of the things for the two was we were noting it, but we weren't noting it necessarily in the correct spot that the state was pulling from in order to report it. Same thing with some of the college credit pieces, some things with the workforce. So there's a lot of things we learned over the past year. Even one of the things that was, once we started learning these things, it was like, well, it's too late to make any corrections. What do you mean it's too late? The state gives you the spreadsheet to look at your data in the middle of September, and it's due by October 10th. So as we were starting to learn some of these things, it was like, well, it's October 12th, sorry, the window's closed. And it's like, oh, so yeah, so.
So you
There
can't even
are-
update anything if it's wrong then.
Correct, so that's why we really have a feeling of working hard over this past year for this last year's senior class. Next year's report card, I think we're looking at anticipating maybe it even being 4 stars, if not better.
So who inputs the data? Is it the counselors?
I think right now it's guidance counselors along with our guidance secretary, but that's also been another piece of conversation of how to uniformly making sure we're putting everything in the right spot with who we're working with. As well as these pathways, as well as making sure if a student is doing multiple things, making sure we're getting credits for all the things that they're doing, not just what's needed to graduate, because this component reflects everything as a whole.
Great.
And maybe just to
I'm glad to hear that.
And to answer one, since this is a full year in the rear, their SSID numbers seem to follow them so that we know who enrolls into a 1, 2, or 4 year.
But you wouldn't know who's employed necessarily.
And the employment isn't based on whether you're employed, it's whether you did enough during the time you were here to get all of the points that you
I
need to get.
appreciate your
Well,
clarification.
it sounds like we're doing a lot of the things, although we're learning more. It's almost more of a
Reporting issue.
So it's not like, it doesn't sound like we're truly deficient in the area. We're doing the things, it's just where the state pulls from.
I would say,
Like EMIS data.
I think it's a
Right.
little bit of both, it's a little bit of both. I mean, there's 11 different measures that make up this component. And so trying to make sure we have enough opportunities for our students, within those 11 components, there's some things we didn't have and some of those were the pathways. But it was a little bit of both for us of, we really need to be mindful in these things. Not all of our students are gonna go to college, not all of our students are gonna go to the military. So how are we making sure they have tools in the toolbox so that if they do go the career, they can change and they're just not working at McDonald's the rest of the time? How can we beef it up? And then can we send them with a certificate or something? So that's hence with the the electrical pre-apprenticeship came out, some of the other KTC courses, partnerships, so just truly trying to be mindful.
Now, is there some training that's going on with the guidance area and Chris to kind of cross-reference all of that information?
There have been
To make
things, I
sure
know
we're-
Sean Jacobs has gone to meetings, I've gone to meetings and pulled back some things as far as
Okay.
this is where it needs to go, this is where it is, and so I've been
Okay.
working with Ben Richards and the guidance counselors to make sure that, hey, here's the information I gleaned, here's where it needs to be, and then we
Okay.
need to do some double checks now that we know this is the process. So
Okay.
yes, we've been trying to do
Not very
that.
clear on some of this? I think they rolled it out and they just, they didn't give you a lot of a
Okay.
roadmap to do it.
They clean it up as they go.
Yeah.
I do feel like
Well, no, we do.
Yeah,
I mean,
that's it, that's what I'm saying.
the EMIS audit that we did was helpful because who was reporting what? We don't really have necessarily just one EMIS coordinator. We have some functions of the EMIS coordinator that are done by other people. And we used to have kind of a
Right.
halftime EMIS at the high school, who does what, we had to clean some of that stuff up. But to Kathy's point, it's a little bit of both. 2 years ago, we didn't have the pathways that we have today, because we weren't sure exactly how all that was going to work. The reality is, because we've just validated our data, they just got done validating it, because we got this October deadline for, we
For
think we're
next
gonna be in a
report card.
4-star range next year already, just because of 1 year's worth of changes. Now, I don't know, I did some calculations, I don't think that would have made us like all of a sudden a 5-star district.
Right, no.
It would have bolstered our 4-star. So that 2-star in that category didn't really drop us much, but it would certainly have bolstered that. The other thing I think is really interesting to put here, while we're developing new career pathways, they're doing some really neat stuff, and I shared an article with you in our board update about what our high school did during Professional Development Day. So Corey and their staff have taken the entire teaching staff and broken them into 3 groups. The 3 E's is what they're calling it: enrollment, employment, and enlistment. Because those are the 3 areas that are really measured in the CCWMR. And so, the enrollment group, they went to a college to really understand all that is needed, required, and so on and so forth to make sure that that subset of folks we can work with. We had another group, the appointment group, they went to a couple businesses to really so they're going to kind of lead that group that's really walking down that kind of pathway. And then the enlistment group is a little smaller group because it kind of stands for itself. But there's a group that's really focused in on that. We found out through the data verification that we had nobody that was enlisted on that score from 2 years ago. We just put it in the wrong place. We didn't put it in the right place. Because every year we have graduation and we say, all those, and we get, half a dozen to a dozen stand up. Well, when we looked at the report, it said 0 enlisted, and we were like, there's no way. Well, we were marking it in one spot, and it needed to be marked in another spot, and we didn't have the opportunity to verify it. So little things like that really kind of make a difference.
Ask one question. On the employment side, do our career center students fit into this data on the employment?
Absolutely.
Okay.
And what the Career Center does, so here's an interesting little caveat to this. Some of our cohorts, like Danville and Fredericktown and East Knox, they scored pretty high in this. And we were like, well, how could they do better than what we did? It's a simple answer. Most of their seniors go to the Career Center. There's like 5 seniors at Danville who don't go to the Career Center. Well, the Career Center was built on pathways. So the Career Center, you're going to score really well because that's the function of a Career Center. And when you take a look at East Knox and you take a look at our smaller schools, a large portion of their senior class is either CCP or their Career Center. And so it's built in naturally. For us, we have like 150 students who fit right here in this category of Mount Vernon High School. And we have to make sure that we can get them to fit into these factors, if that makes sense. They've talked about some schools, I mean, they don't really even have a senior offerings because so many of their kids go to the Career Center. And that's a great alternative. And then the Career Center is perfectly built for these pathways. They really are.
I have a question regarding certificates that can be earned. I know the Career Center Superintendent Kathy Greenwich sent us some information regarding the liberal arts, creative art and performing arts, not liberal arts, sorry. It's my college background. And I wondered if we followed through on that, and are we offering, how many certificates are we offering
I don't know
show
if I would know.
preparation?
Yeah, I guess I'm not sure, I can only hear part of it, but I don't know what categories of those career centers.
It's possible to use performing arts and music and drama.
As certificates?
To get certificates.
Yeah, that one I don't know, I know we use that for like, one of our fine arts seals, I mean, that piece, but I don't know about a certificate.
We ought to look into that and make sure if there really is something that, hey, if you're in band and theater, what does it take to get a certificate?
Didn't they say there was also money available to support that?
Correct.
And that was the big piece of it.
Yeah.
What was that?
There's
Financial.
actually financial
Oh,
support for that program, so.
Well, that's something we'll try to get back to you
And
on.
maybe if we have the seal already, which we
Right.
do, then it's a no-brainer to follow through on that.
Yeah, we'll look into that.
So all in all, I'm really proud of the effort of our kids, our students, and our teachers in the report card, a 4-star, top 10%, and exceeding state standards in almost every single category. And to be one of the larger schools that doesn't just happen. So, well done. Wanted to give you a quick food service update. Judy and I meet regularly with Aramark in a review, and I wanted to share a couple things that are going on. So we've done some new things at the high school and the middle school with new hot food slides. So if you've ever been to like a food court, you see these, they'll put burgers and they'll slide down to the front. We never had that before, and so they keep them warm, and it's grab and go kind of things. It's speeding up, but it's allowing us more grill type menu options. We put in new cooling units at the middle school to have more fresh things. We didn't have a way to keep those things cold but yet available. So they slide those now, they can get salads and different things like that. I think full service is now at Wigan Street and Dan Emmett where it wasn't before. So remember, we had 3 buildings where we had to put it in the little tins and seal them up, and we put them in a warmer and we drive them to the school. We're only doing that with 1 school right now, and that's East Elementary. For the most part, we're serving now with these full service lines. So we bought these hot carts. So instead of putting mac and cheese in a small little tin and then covering it up and trying to reheat it, we're bringing over a vat of mac and cheese and we're serving it fresh.
That's awesome.
You can see some of the more of the fruit type of things where we're trying to get a little bit more into the full service side of things.
I'm sorry, is there much waste with that? I like that idea a lot though, but is there much waste with that?
With the vats?
Yeah.
I haven't heard much of it. I don't know if sometimes they can serve it the next day if it stays in the hot and they can redo it. I think they get pretty good at kind of getting a pretty good guess of how many they're gonna have. There's probably always some waste. The one thing we do have, which is really interesting in all of our buildings, especially the elementaries, is we have what's called share bins. So you have to have so many items of a meal to be able to count as a full time, and we want them all to count full time, right? And so they say, oh, honey, you've got to get a fruit. I really don't want fruit, but I'll get an orange. And we count it as full, and then they walk over and they put it in the share bin. That means somebody else can come up and, so we don't have that much waste.
That's good.
Carrots, maybe sometimes carrots aren't getting eaten quite as much. That gives you a sample. This is Pleasant Street. This would be a typical meal that they would have. They get 3 choices. Here is pizza, salad, fruit, and of course the milk's not on here. Here would be a turkey sandwich, cucumber salad, gold fruit and milk. Here you get into we always have an Uncrustable peanut butter and jelly, the kids love it, goldfish crackers, fruit, and milk. And so they would, at the elementary level, they would get these three choices that they could get. This is another example of what they just gave out. I know sometimes we see things on social media that kind of depict things in a not so good light, and sometimes you can take a piece of your meal and take a picture of it, and it gets shared, and people are wondering what's going on. And again, I'm not going to stand here and pretend that everybody loves everything that's cooked, because they just don't, right?
Government cheese is.
Yeah, the government cheese, I guess, isn't as good as regular cheese.
American, I don't know.
This happened to be a breakfast tortilla. And again, you open it up and you see 2 chicken nuggets, cheese, and a tortilla shell. It absolutely doesn't look the greatest, but they do have some other choices. It would be nutritious, yet. And so we talked to Meg about it, because we do occasionally have people who will see something they don't like, they'll take a picture, they'll send it home, and it finds its way. And then, I think this particular one got like 136 different looks at it. And, people, will take a quick look and they'll comment, I suppose, and judge.
The beauty of Facebook.
When the reality of it is, we're doing better. We really are doing better. Judy has been really, really supportive of some equipment stuff. We probably pushed ourselves to the bare bones for a lot of years and didn't do a very good job, quite frankly. And that I'm saying from my end of things, of replacing equipment. And we've got some equipment that needs to be replaced, and we're slowly doing some of that, which is really good. Here's just a typical menu, and I pulled this off as a secondary menu. So here it was. Well, let's just take tomorrow as Tuesday. They have 2 entree items they could choose from. They have 2 grilled items that would be on the sides that they could choose from. We always have an express menu, which in this place it's a turkey wrap. They could do their peanut butter and jelly. So you can see the kinds of choices they're having that maybe they didn't quite have before. And again, I can pick one of these out, it wouldn't look good to me and I wouldn't want to eat it, but that doesn't mean I don't have other choices that they can have. So
That's great, though.
yeah. Last slide here and we'll move right on.
Yeah, I was gonna say it looks even better right now.
Now we're all hungry.
I know. 2025 LCL Golf Champions. So as we've kind of trickled our way into the LCL, we're finding a lot of success, and that's neat to see. And we still have.
Smiles, that's
Yeah.
beautiful.
Yeah, it's been a while since I'm not sure when the last time is we were golf champions, but the kids really did a good job. So that's my report. Any questions on that? Well,
I have one.
okay.
Where do they store the equipment at Wigan Street for the hot trays and stuff?
So they keep it right in the room and have to cover it up.
Okay.
You're talking about the hot bin
Yeah.
thing? Yeah, that and the table, unfortunately, they have to push it up against the wall, kind of protect it, because they're gonna have art down there and they're gonna have music down there.
And isn't that the gym also?
No,
No,
not
gym's
there.
separate.
They have their own gym at Wigan Street.
Okay, okay. All right, thank you.
The only other items here for information is our board work session scheduled for the 8th. Hopefully that's, at least as far as the tax policy, that'll kind of wrap us up. And we're going to see some interesting scenarios, I hope, that we can move forward. But no items in this section for your approval tonight.
All right, moving on to curriculum instruction and Dr. Bennett.
There's really not much to share. There were 3 items, and the first one was about New Richmond's exempted village partnering with Cincinnati Children's Hospital, which we've already done with Nationwide. And that was very timely that we just gave a presentation, and this was a success for this month. And then the second article is about Columbus City Schools, Fort Hayes Career Center, constructing a house and partnering with Habitat for Humanity, and they're building one house and it takes about 8 months, and then they have another one scheduled for spring, and they use land bank lots build these.
Yeah.
It's pretty neat. And then the third article is just encouraging us to nominate a program for the Student Achievement Fair. And the last was on the research articles on the post-pandemic student achievement levels still lower than the pre-pandemic. So they're continuing to look at that data. So hopefully we're doing better than that.
We are, yeah.
Just a quick note, I believe we've had our Career Center students also work with Habitat for
That is
Humanity.
correct.
haven't we?
Yes,
Yeah.
yes, yeah. They worked on 2 houses on Columbus Road,
Right.
yes.
No items for board approval tonight at this session?
Yes, just last year, last spring, we did David. All right, moving on to fiscal services, Judy.
Okay, the first item there, of course, is the financial report. Unfortunately, this is a whole month old now, but anyway, this was the end of August, and you can scroll down there, Bill, and see.
Yeah, I was trying to get rid of this little fella
Oh,
right
it's not your AI summary.
Don't want him there. There we go, okay.
So again, on the first page, you can see our total cash in all funds, clear way up there, almost 32 million right now. Again, this is the end of August, so, and this was based on the forecast that we had as of the beginning of September when I was working on it, so you can see your amounts there. We won't get any more tax money until February, after the first of the year when they collect taxes again. And I guess you can scroll down there again, and you can see the salaries and benefits and so forth. The next report is the investment report. 181,000, that's in 2 months, so we look like we're probably going to do pretty well again in investments this year. And then the rest of that is the printed reports. The other items that I have of the fiscal forecast, if you want to click on that one first. No, not that one, the other one first. Yeah, that one's, Bill, do you want to pass this out? This is a much better copy of that forecast, a little easier to read.
Do you need it to read?
I've got one. So this is the same. Should be the same.
I hope it's the same.
Well, we go in there and make changes like, oh, wait a minute. So obviously you can look at the column that says fiscal year 2025. That's last year, that's over. Those are all actual numbers. And you'll see in line 5.010 that transfer out that 5,550,000. So remember, if we hadn't done that, that would have been in the bottom. That would have been included in that 12 million. So you can see how much cash there would have actually been. Current year then is the following, the fiscal year 2026. That's what we're in now. Everything remains the same, which I'm about 99% sure it's not going to. We'll end up the year with almost $15 million. And I'm sure everybody knows that the state's talking right now as we speak about messing up all of my top 5 lines. So, we don't know what we're gonna get, but all of the treasurers decided this has to be filed by October 15th. We're gonna file it, even though we know that things are gonna change. But if you look at the bottom line, which is of course the most important line, well, actually this line 6.010 is the most important line, because that shows you when you start to deficit spend. We did not deficit spend last year. We took $5 million away from the general fund and put it in 2 other funds. But for this year, you can see we're still in the black. Next year, everything remains the same. We'll be deficit spending, but by a couple $100,000. So with our kind of budget, that's probably not a problem. But as you go farther on down, our revenues are not going to keep up with our expenditures based on our assumptions.
Would you explain for the public what deficit spending is? Because we've had community members misunderstand that and think that we're going in debt.
Okay, deficit spending just basically means we spent more than we took in any given year. We are not in debt. We have a very healthy balance. In fact, the auditor's office it's interesting, they have a new thing going, fiscal health analysis, that they want us to be sort of like the report card. At the end of the year, they want to look and see how we've done. And one of the most important things that they look at is the health of your carryover balance. So on that way, they want us to have a nice carryover balance. On the other side, they say we have too much money.
You can't win.
We can't win either. But yeah, deficit spending just doesn't mean that we're broke, doesn't mean that we're going broke. Means that we have to start paying attention to our revenues and our expenditures.
Yeah, use some of our savings.
That's right, that's exactly the way to look at it, to chip into the savings. So again, at the bottom, you can see we're looking at about $15 million carryover this year. Next year down to 14, and then you can see as it starts to drop off. And that's not so much a really indictment of our revenues as it is that our expenditures are gonna go up because, so. But if, Bill, if you wanna click on the PowerPoint, it's a lot shorter than yours. Sorry.
I'm just a little windy here.
Well, these are sort of like highlights. They call them key indicators. You can see the beginning balance and the ending balance. We're gonna end up with more than we started with this year. The gain is about almost $2 million. So revenues obviously are a little higher.
At least as far as we know right now, right?
Pardon me?
As far as we know right now.
As far as we know right now, yeah, these are all, everything is. The next slide. It's interesting to see where our money's coming from. Our local taxes is a little over half. Our state funding is 40%, 41%. And the other amounts, and we talked about looking at that today, that other resources includes things like our interest on our investments, the tuition that we get from other students who we educate that aren't our students. Those districts have to pay us. And our Medicaid funding usually is a little under $1 million a year. So you can get up to $3 or $4 million pretty quickly on that. And any kind of miscellaneous thing. We don't take in a lot of fees anymore, but any fees that we take in, any kind of miscellaneous items go in that. I guess it's about 8%.
Judy, the one that I usually will see here is a small sliver of federal funding. Is that included in all?
No, none of this includes federal. This is only general funds. Federal grants are a different fund.
Okay.
So there's no federal money in here. So just for clarification, if I did a report that showed all of our money for the year, we'd be way over $60 million instead of 52 because of the federal grants. But yeah, there's none in here. This is a general fund only.
It was close to 70, wasn't it? 69 or something.
Yeah. So there's our expenditures. You can see personnel costs, about 77%. That includes salaries and benefits, purchase services, and our other expenditures include operating transfers out, capital projects, those kinds of things. Supplies, which tend to get a little bit bigger every year. So this is looking at a 3-year financial outlook is the net loss for the year would be 1.7 million. And then if you look at the whole 5 years, the trend, we're going all the way down to 5.8 million. Again, none of this could be accurate, or it all could be, we just don't know right now. Based on what we know now. The annual change in the revenues, annual change in expenditures, those go back for 22, 20 to 25. And remember, a lot of the expenditures were back in 23 and 24 was coming back from that COVID money, where we used the COVID money to pay for those. And last year, even this year still, we are putting some of the money we're having to pay for some of the things that we actually were still paying for out of COVID last year, because we still had some of that money. And days cash on hand, we talked about this with David Conley. We ended up with 90 this year. If we ended up with the balance we're looking at, we'd be over 100. And then you can see in 2030, 37 days, that's not gonna work. So
Yeah.
we'll have to make some changes between now and then. And what else do you have? This is the enrollment. I did a really interesting project with our 5-year forecast people where we uploaded our actual current EMIS, speaking of EMIS reports today. And it looks like our enrollment for this year has dropped a little bit. I didn't get to put it in before I did this, but I think another 30 or 40 students off of this amount. I can show you that next month, but.
I think Judy and I talked a little bit about this demographics is because we have so many students that go other places, we probably more likely have close to 3,550 students, but we only get to count fractional amounts of them. So when they go CCP or they go Career Center or they do these other things, from a full-time equivalency standpoint, they're noted differently.
That's right.
Also, this graph exacerbates the change because you weren't starting from zero, you're just going from 3,200 to 3,650. So this graph, we're from zero, a scale of 0 to 3,600.
There's a perception to that,
Right,
sure.
it would show a much smaller difference.
Yeah. And you could say that about a few others probably.
So we've exaggerated it, in this.
Per pupil. This was go ahead.
Yeah, this is the per pupil general fund expenditures. Now, it's not gonna match up with the state report card because this is general fund only. And they're using a different enrollment, so. But these are the numbers based on actual, if you look at the last 5 years, and then of course the from going forward those are all projections.
So when we send out this prospectus, that shows us being, quite frankly, low per pupil spending. What is different with that than different here?
Well, that's from the report card and that's all funds.
Okay.
And this is general only. So everything about the 5-year forecast is only general fund, because that's our operating money. The other amounts are grants and, things like, even the food service is included in there. So this is gonna look a little different. And, we need to make sure we talk about that before we do the prospectus. So that, nobody other than us is probably gonna dig into these, graphs. But this is accurate. This is exact amounts based on last year. If you took the total amount that we spent from last year and divided it by our enrollment, this is the number you're gonna get, so. And that's the frustrating part about, a lot of what we get is, we get this from the state on your end, we get this, which is actual, and people are trying to match it up. And, the numbers are what they are, but, you can add different things or take different amounts that you're working with, so.
The first few columns there, which are obviously lower, visually lower, is that because of the COVID?
Sure, absolutely.
And now it's not there.
No, because this is just general fund, so we saved all that money, we didn't spend it, which is why we have a bigger balance now. So, yeah, those expenditures are
So
low.
that's what's
because of that.
happening there.
Exactly.
Okay.
They bounce back
So
up.
to the public, it would look like we were way down.
We had really increased our spending, when
That's
the reality
exactly
is the
right.
funding
We
source
didn't-
went away.
That's right.
Maybe you should put a footnote on there. A star by
Anyway,
this and an
That's just how it
asterisk.
struck me.
Well, there is some thought behind that because I know that this prospectus that you probably haven't gotten a chance to see yet, it shows us spending the least per pupil than the state average. And it's based upon, data that was collected at the state level. It would feel like it's maybe a different story than what you're seeing here, so we want to make sure that we're accurately, reflecting what people can realistically.
And those are fiscal year dates at the bottom, right?
School years, I would say fiscal years.
Well, they should all be based on fiscal years. All of the, even the
So
states.
it's 24, 25, and if it's 2025, right?
Correct, the year that just ended in June.
Okay.
There's a daily cost per pupil, and I don't know what happened to all those zeros and ones, but somebody did point out one time, and I still think it's accurate if you want to think about it, for $83 a day, and this is what the person said, that it was a seminar. So we pick up your child, take them to school, take care of them, keep them safe, feed them, educate them, bring them home safely for $83 a day. That sounded like a bargain when you think about it, so. And that might be the end of
Pay
it.
more than that to a babysitter.
I wondered.
That's right,
I
yeah.
wondered if the food service cost was in there.
No, that's not general fund.
Okay.
Yeah, so it wouldn't be in there. And that's just for compared to the base, that's actually not very, I should have taken that one out because that's from a different forecast. And go the other way.
Interesting, thank you.
Appropriations?
And the appropriations are due. I had the auditor's office call me today and say, are you gonna send in your appropriations? They're due October 1st. I said, calm down. My board's gonna approve it
It's
tonight.
all good.
So, yeah. So we did appropriations, as you remember, in June, so we could spend money. By September 30th, we have to send over what they call our final appropriations, but we're able to
There is
adjust them
no
all, yeah.
final.
They're final, probably, maybe not. We get, sometimes we get, surprise federal money. Some districts, believe it or not, don't take federal money. And so about in the middle of the year, they gather it all together and give some of it out to the rest of us. So we can't spend it if we don't appropriate it, but I don't think you're gonna see any changes in the general fund after this. You can see the other ones are mostly the grants. The 400 funds and the 500 funds are the state and federal grants. And then I have donations. You can see to Pleasant Street from Lori Ash, bag of school supplies, to Wigan Street from Liz Keeney, and Kleenexes, pencil box, notebooks, dry erase markers, Band-Aids, glue sticks, and bags. To Columbia from Kokosing, $200 for STEM bins. To Student Services from Lori Ramsey, former employee here. All the Pieces, it's a book when a loved one dies from substance abuse. To the district from Dollar General, 7 boxes of clothes. Mount Vernon clothes, I think they were logo clothes. And to Pleasant Street from the Lions Club, 3 bags of pants and a large bag of shoes. And that's it.
Any questions?
Thank you for all that.
Let me just say Judy and I followed a webinar today that was put out by OSBA, OASBO, BASA, the whole group. And I was initially worried about what I saw last Friday. And Judy made me feel a whole lot better because what she does an amazing job with is she's conservative in her forecast. And so what we noticed in there is what looks like it could be a potential real negative. She didn't build in much in the way of any property tax increase to begin with. And that's just some good forethought thinking. You know, you can always hope for better, but plan for the worst, I guess, is maybe the right word. And appreciate her doing that.
I would entertain a motion for fiscal services.
So moved.
Thank you, Mr. Ward.
Second.
Thank you, Dr. Bennett. Any additional questions or comments?
Call the roll. Mr. Ward,
Yes.
Dr. Bennett,
Yes.
Mr. Workman,
Yes.
Mr. Rolladai,
Yes.
Mrs. Getzmann.
Yes. Motion carried. Moving on to business services tonight, and Ms. Vergola-Dye.
Thank you. Not too much to report, I don't think. But the General Assembly is back in session in Columbus. They held hearings on congressional redistricting, and we expect additional budget veto override votes. Those have not come to fruition as yet. A lawsuit has been filed by STRS, OEA, OFT, and the Ohio Conference of the American Association of University Professors to prevent changes to the makeup of the STRS board. There is a stay right now in the courts on these changes. Some bills that have been introduced, SB 272, which would replace the American government exam with a civics assessment. HB 431 would require human trafficking screening in public schools. HB 455 would make changes to the operation of public schools and ODU. HB 420 and HB 421 are both called the Taxpayers' Freedom Trilogy, Acts 1 and 2. And there was something else additional. I did contact via text yesterday, Senator Balderson about, in general, funding of public schools.
Good.
That's it for now. Any questions or requests? Thank you.
I will just add to that, tomorrow is our understanding that property tax work group will be bringing out their recommendations. So
And this is the one the governor.
this is the one the governor appointed.
Yeah.
So maybe they did some tea leaving today during our meeting, but they really didn't come right out and say much. So it'll be interesting what this task force kind of comes up with, what the House and the Senate kind of like about it or don't like about it. Will they go out on their own? It's just really hard to tell. So we'll be waiting just like you. In this section item for board approval, we have a number of them here. A lot of them have to deal with our working partners, be it St. Vincent and Seventh-day Adventist. We're kind of the pooling agency for them for certain services. So the first one is a Title I pooling agreement. We also are a conduit for their therapy with St. Vincent. So when they get therapists, the money flows through us. Pediatric, a speech contract with Seventh-day Adventist. Also another Title I agreement with Seventh-day Adventist Elementary. A number of facility use requests you can see there, from jazz orchestra all the way to Special Olympics, to Girl Scouts. So quite a few facility use requests for your approval tonight.
I would entertain a motion for business services as presented.
So moved.
Thank you, Ms. Regola Dye. A second.
I'll second.
Thank you, Mr. Workman. Any questions?
Mr. Holliday,
Yes.
Mr. Workman,
Yes.
Mr. Ward,
Yes.
Dr. Bennett,
Yes.
Mrs. Getzmann.
Yes. Motion carried. Moving on to student services.
One item for board information. Generally during the year, we do a determination of transportation and practicality. And you're seeing that exhibit there as items for information. And then that usually follows with a resolution, which are part of the board items for board approval tonight. A resolution to pay for that transportation that we can't provide. And that's usually paid to an individual in this case. Item 2 is special education service agreement. And item 3 is elite transportation of a service agreement. Both of those items deal very specifically with a student that needs special services. And we need to have those contracts in place to pay for that. And then items 4 and 5 are also contracts, one with audio video interpretation, translation services, and the other, which is Hardenwell, is service that we provide when students go into the hospital. And we have to provide an educational conduit for that student. So those 5 items for your approval.
I would entertain a motion for student services.
So moved.
Thank you, Ms. Regola Dye. Second.
Second.
Thank you, Mr. Ward. Any questions?
I did have a question about the Learn Well, but I think you explained it. So since they're in Massachusetts, that works pretty well with the online.
It is it's a virtual learning.
Do they use something like Facebook or Zoom or?
I don't know the exact platform that they use, but obviously when a student's, let's say, in a hospital setting, that they can get that kind of back and forth.
I know we do through some of the speech services, it's online. It's kind of a Zoom situation with that. Okay, would you call the roll?
Mrs. Holliday,
Yes.
Mr. Ward,
Yes.
Mr. Workman,
Yes.
Dr. Bennett,
Yes.
Mrs. Getzmann.
Yes. Okay, motion carried. Moving on to personnel certificated license staff.
One item for information, some salary change notices that are reflected there. Under item B, recommended items for board approval tonight. We've got some employment components here. We have a number of retirements already. And again, losing some pretty amazing teachers here, and we're learning of it early.
One in particular, right, Mr. Ward?
No bias.
Give us an opportunity, a really long runway to find the right kind of replacement. Big shoes to fill there. We do have one resignation, item B, and a bowling resignation as well. 2 rescinded contracts, a whole list of substitute teachers, of which we've added one for tonight in your addition. We've had 1 internal transfer, and home instructor, and then a whole list of supplemental contracts. Seems like school year just started and we're already talking about basketball coaches, and so on. Believe it or not, we're now past the halfway point of football season, which seems like we just started, so.
Yep.
And then a number of other audio media specialists, pupil activity for contracted lay persons, and you'll see a list of those down here at the bottom. Items A through J for your approval.
I would entertain a motion for approval.
So moved.
Thank you, Dr. Bennett. Second?
Second?
Thank you, Ms. Regola-Dye.
Can I ask a question before we vote?
Yes.
Since my wife is listed there, should I be abstaining?
Probably.
Thank you for clarity.
Dr. Bennett?
Yes.
Mr. Roll-Dye?
Yes.
Mr. Ward?
Abstain.
Mr. Workman?
Yes.
Mrs. Getzmann?
Yes. Motion carried. Okay, moving on to classified staff.
Under classified staff, 2 items for information, and they're both kind of in the area of food service, kind of a transfer from one position to another position of need, so we appreciate that. And wanted to share that information, but item B are recommended items for board approval. You see a number of employment pieces here, food service driver, and a 3.75 hour cook, a number of 2-year contracts and substitute employment. Certainly appreciate those folks. Some summer IT, part of our work crew, which is a retroactive piece, and then some professional committees with 1 resignation, our food service delivery driver. Those 5 items for your approval.
I would entertain a motion. Can you talk to us? Thank you, Mr. Ward.
I'll second.
Thank you, Mr. Workman. Any questions or additional comments?
Congratulations, Mrs. Ward.
Mr. Ward?
Yes.
Mr. Workman?
Yes.
Ms. Regola-Dye?
Yes.
Dr. Bennett?
Yes.
Mrs. Getzmann?
Yes. Motion carried. Moving on to board member comments tonight. And Dr. Bennett, would you like to start?
Sure. I have been talking with parents and have had so many good reports about how much their kids like school, love their teachers and administrators and staff. And I just wanted to thank our teachers and our administrators and staff for caring about our kids so much, doing such a great job, and meeting parents' expectations. So just at the football game even, a parent told me their daughter goes to the middle school, and they're just so excited, about every teacher that they have. I said, well, is there a favorite teacher? She loves all of them and the staff, and just having a wonderful experience. And I just thought that speaks so well of our teachers. And I know that the administrators are supportive of our teachers and the staff contribute. So thanks for leading a great group of people.
Ms. Regola-Dye?
Thank you. I have a brief story to tell. After I was leaving an appointment today, I ran into one of our former parents, elementary school, that I experienced, from Pleasant Street. And when he told me what his 2 children were doing I was so moved and so proud. His son has 2 degrees, and at one time worked with the FBI and is now in a business area. His daughter, 2 degrees, is working as a dispatcher, and she helps talk down people who may be thinking about committing suicide or doing violence. And I was just so emotional about what he said. And he said that the kids are still involved in music and that they are doing so well. And he credits Mount Vernon City Schools with how they have succeeded. And there is a misconception out there that public schools are failing. We are not failing. We are graduating such great students who are contributing to our communities. And I was very moved, and I thanked him profusely while I cried on the way to the car. So congratulations to all of our teachers and all of our staff from top to bottom. Thank you.
Mr. Ward.
Okay. Wanted to acknowledge the district and the school report card for Mount Vernon. Very proud of that. But I do specifically, I feel this need to acknowledge the middle school. I spent most of my own professional career in the middle school realm, and I know that's where a lot of issues converge. And to see how they've elevated themselves is really something to be commended. And so I want to thank the administration, thank the school administrators, the teachers, whomever else. Well done. Also wanted to say how much I appreciate, digging into the data. I've been watching some of that here in this meeting itself. Knowing that that's happening is comforting, and 2, you're sharing it with the board, which is comforting. So wanted to thank you all for doing that. It's very much appreciated. Wanted to congratulate our golfers, the boys golfers, the team. They're doing great things in this Licking County League. I'm really proud of the move we made in maneuvering that the past couple of years. It really reflected well on Mount Vernon, so well done. Also want to acknowledge our girls cross country, Lucy Rush in particular.
Yeah.
She's running away with everything, literally. And so it's quite a thing to see.
Semi-merit finalist.
Yeah, it's like, oh, by the way. And then finally, just want to acknowledge my wife's retirement. Well done.
Now it's on record.
How many years was it?
32.
Wonderful.
Yeah.
Well,
I can go next and leave you, bro.
Yeah. So,
sorry, guys.
Yeah, that was a lot, but really good. I really enjoyed listening more to the folks from Nationwide because I think we all, well, for me, I'll speak for me, kind of knew what they were doing, but to hear some real clarification on that, and to know that there's additional capacity that's there is super encouraging. And as I was listening, trying to figure out how we can continue to get the word out, because I think that's important. And I know that parents know of it, but whatever we can do to continue to get that word out, it's obviously working. And I like the clarification from the standpoint that they said that, one of the things early on, there was a public perception of kids being treated without parental consent. We know that's not true. And the fact that, they're not replacing family physicians, or only complementing and providing additional access points. So some of that clarification was really good. I think we need to find a way to get that information out further, however we can do that. But that was good. And then also just like to congratulate the school district on the grade card. What an excellent report. That doesn't happen by accident. And, congratulations to the administrator, teachers, students. It takes a lot of work, and it's really encouraging to see, especially on the one area that we now kind of figure out from a reporting standpoint how to get there. But really good news there. Some of the scores outstanding, and again, there's been a lot of effort that's went into that. So I'd like to thank everybody for that.
And now you expect me to. No, a couple things. I don't want to start out of down, but I just want to extend my sympathy to the family of Jan Hawkins. She was a teacher at East Elementary for many years. And so she did great things, and she was a great supporter of East School. After her retirement, she was one that we found on the sub list and was in there for the Eagle's Nest and all of that. And so condolences to her family. But then we'll revert it. And we've heard all of these amazing things that are going on in our district that we're doing, from our grade card, from our food services, from our hospital, from our music, our athletics, and all of that. But I have to give hats off to Judy, because we couldn't do all of these things and be where we are without our fiscal services and knowing that we can afford all of these things. So thank you for your eagle eye in making sure that we are financially responsible to be able to do all of these things. So thank you for that. And for Bill and for your leadership as you continue to navigate this ship. So thank you for that. And
I feel we ought to have a toast here.
here we are. We are doing great things for sure. Judy or Bill, any additional comments from you for this evening? No?
You got nothing.
All right. How about a motion for adjournment? How's that? Thank you, Ms. Regola-Dye.
I'll second.
Thank you, Mr. Ward.
Roll a die.
Yes.
Mr. Ward,
Yes.
Mr. Workman,
Yes.
Dr. Bennett, Mrs. Getzmann.
Yes. Okay. We are adjourned.
Okay.